So now we're going to move forward into the concussion assessment. Remember, there are three major components. There is the cerebral component, which is more loss of consciousness, assessing mood and behavior of the student or student athlete that you're working with, and several other memory tasks that I'll discuss in a few moments. Next, there is the cerebellar component, which is your the balance of the patient after they sustain a head impact. And then lastly is the set of cranial nerves that I went through in the lecture. So for the cerebral component of the assessment, make sure that you take a look at the SCAT-5 that I posted into Canvas. This is more or less the standard protocol that we use for sideline assessments. Some people even use them as a baseline assessment or a post-impact assessment in order to understand the different changes that may have occurred after impact. Within the SCAT-5, there is a really nice layout in terms of how to assess for loss of consciousness, several different red flags that I highlighted from the NATA position statement, and then different memory tasks that you can assess cognitive load and how perhaps that may have changed after impact compared to their baseline assessment. The second component is the cerebellar. So remember, that is your balance and coordination, and there were two special tests that I highlighted in the lecture video that I'm going to demonstrate with Cole. So the first one is the heel to shin test. So I'm going to have the patient lay all the way flat, supine. Good. And I'm going to instruct Cole to take his heel, and I want him to slide it along the inside of his shin, upwards towards his knee, and then back down towards his ankle. So go ahead and show that. Good, and then back down. Excellent. So that would be a negative test because he doesn't show any signs of abnormal movement. If you look on Canvas, I did post what a positive heel to shin test would look like. So make sure that you do take a look at that at some point within the next week. Next is the Romberg test. So I'm going to have you go ahead and stand up. I know that in the video they only had one version of the test, but I kind of like to think of it more as a progression. So I'm going to stand next to the patient and just kind of guard him to make sure that if he does feel a little bit unstable, I'll be there to catch him accordingly. So the first position that he's going to be in is I want him with his feet together and then hands on your hips. And he's actually going to start out by just looking forward with his eyes open. So if he's able to tolerate that all right, and I don't see any abnormal movement, I'll say, okay, go ahead and close your eyes. Again, I'm just looking for any abnormal body swaying, either forward or backward or side to side, but he seems like he's tolerating that pretty well, so I'm going to go ahead and progress him to the next step. Go ahead and open your eyes, and I want you to stand on one foot. Good. And I just want you to go ahead and look straight ahead. Usually I'll have patients hold this for 10 to 20 seconds, depending on how much they can tolerate. If he's doing all right with his eyes open, I'll go ahead and remove the visual stimulus and go ahead and close your eyes. Again, I'm on the side here just in case he does fall, but it looks like he's doing a good job. So that would be a negative assessment. I want you to go ahead and sit on the table. The last component are the cranial nerves. So I'm going to discuss all 12 of them and how you would assess them on the sidelines. Remember that I will ask you to suggest how you would test these on the sidelines during your clinical assessment. So it's very important that you not only know the order of the cranial nerves and their number, but also how you would appropriately assess them. So the first one is olfactory. So remember that is smell. If I was on the sidelines, perhaps I would get a cup of Gatorade and I would put it under his nose. I'd say, can you tell me what flavor of Gatorade that is? You never want to use a smelling salt just because those are extremely strong. Something with a little bit more of a subtle scent would probably be preferred for that. Next is optic, so that's part of the visual complex. I may say, Cole, can you read the clock and tell me what time it is? Or can you tell me what the scoreboard says? Something that makes it a little bit more on-field appropriate. Next we have oculomotor, so remember one of the key components to this is pupil dilation and constriction. So I talked about Pearl, pupils are equal and reactive to light. If you have one of those pen flashlights on the sideline, you could use that. Otherwise, if you want to just use your cell phone, that's also fine. So here I have just a cell phone flashlight. I'm going to ask Cole just to stare straight ahead. Don't look at me and don't look at the light. I'm going to just shine the light in his eyes, look for the pupil constriction, that looks good, and then looking on the other side as well. Another way to assess oculomotor would be to just do general eye tracking. So I'll have my finger in front of him, or even a popsicle stick with an X on it would be fine as well too. And I could say, I want you to just track my finger, don't move your head. Good. And then out to the side. Next is trochlear. That's also another one of the eye tracking cranial nerves that you want to definitely assess for. So remember, trochlear is specifically looking down and outwards. So as I'm doing my my eye tracking for the other cranial nerves, I'll also go down and out, and then again on the other side, and just making sure that the eye movement is matching. For the fifth cranial nerve, that is trigeminal, so that's going to be jaw movement and facial sensation. So I may ask him to open his mouth. Good, making sure that it's opening on both sides, he doesn't have any abnormal movements. I may also say, can you feel this sensation? And then also feel on the other side. You can go up across the eyebrows and whatnot. Next we have abducens, so that's going to be lateral eye tracking. So I'll say, okay, just look at my finger here, and I want you just to look outwards. Good. And then back on the other side. Next we have the facial nerve, so that is going to be any type of facial expression. So I may say, can you give me a big smile? Some people say, can you look surprised? Raise your eyebrows up. Any type of facial expressions would be appropriate to assess for that. The eighth cranial nerve is vestibulocochlear, so we already assessed that with the Romberg and the heel-to-shin test, but just any type of balance assessment would be appropriate for that. Number 9 is glossopharyngeal, so that is swallowing. So I could just say, can you just swallow your spit? Can you swallow some water or some Gatorade? That would also be completely fine. The vagus nerve is number 10, and that can also be assessed either by swallowing or the gag reflex. So you could take a popsicle stick and see if they do have that gag reflex. Most patients probably won't like that, so if you just want to do swallowing, that's certainly fine too. 11 is accessory, so I'm going to have the patient shrug their shoulders. Good. And I'm just going to push downwards. Good. And then the last one is hypoglossal, and that is that nerve is in charge of innervating the tongue and tongue movements with speech. So you could have them speak, you could have them say their name, also tongue movements. So I would say, can you stick your tongue out? Good. Move it side to side. Good. And that looks fine. And that's how you would assess for concussion.